You know, when people think about living a long, vibrant life, they often focus on diet, exercise, and stress management. But there's something most people overlook, something that might be one of the most accurate predictors of how long and how well you'll live. And it's something I talk about every single day in my practice: your sexual health. Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon. And if you're facing questions or concerns about your urological health, your sexual function, or just want to understand how your body works as you age, stay with us. We're here to help you understand your body with clarity and comfort, understanding the connection between sexual health and longevity. Today, we're going to talk about something that fascinates me: the deep connection between sexual health and overall longevity. And I want to share with you insights from one of the most remarkable physicians I've ever studied, Dr. Shigeaki Hinohara from Japan, who lived to 105 years old and remained professionally active until the very end. But here's what's really interesting. Dr. Hinohara's principles of longevity align almost perfectly with what I see every day in my urology practice. Because your sexual function, it's not just about pleasure or intimacy, it's a window into your overall health. It's a barometer, a vital sign, a canary in the coal mine. Let me explain what I mean. When you have healthy sexual function, strong erections, good libido, satisfying experiences, it tells me several critical things about your body. Your cardiovascular system is working well. Your blood vessels are healthy and flexible. Your hormones are balanced. Your nervous system is functioning properly. Your mental health is in a good place. You're not chronically stressed or anxious. And here's the sobering part. When men start experiencing erectile dysfunction, and we follow them for 7 years, about 14% will go on to have a heart attack. That's because erectile dysfunction is often the first sign that something's not right with your blood flow, your metabolism, your overall health. So when we talk about longevity, we can't ignore sexual health. They're intimately connected. The 7 foods that support both sexual health and longevity. Now, Dr. Hinohara and researchers studying blue zones, those rare places around the world where people routinely live past 100, have identified specific foods that seem to promote longer, healthier lives. And what's remarkable is that many of these same foods directly support sexual function and urological health. Let me walk you through them, starting from number 7 and working our way to number 1. Number 7, leafy green vegetables: spinach, kale, Swiss chard, arugula, collard greens. These aren't just good for you in some vague, general way. They're specifically beneficial for sexual health. Here's why. These vegetables are rich in nitrates, which your body converts into nitric oxide. And nitric oxide is absolutely essential for achieving and maintaining erections. It's the same mechanism that medications like Viagra work through. They help your body produce and maintain nitric oxide levels. Beyond that, leafy greens are packed with vitamins A, C, and K. Vitamin C is a powerful antioxidant that protects your blood vessels from damage. Vitamin K supports bone health, which becomes increasingly important as we age. And the fiber in these vegetables supports gut health, helps regulate blood sugar, and keeps your weight in a healthy range, all of which directly impact sexual function. When patients come to me with erectile difficulties, one of the first things I ask about is their diet. Because if you're not eating foods that support healthy blood flow, you're fighting an uphill battle. Number 6, fermented foods. Yogurt, kefir, kimchi, sauerkraut, miso, tempeh, kombucha. These fermented foods have been consumed for centuries in cultures known for longevity, particularly in Japan and other parts of Asia. The magic here is in the probiotics, beneficial bacteria that support your gut microbiome. And your gut health? It's more connected to sexual function than you might think. There's something called the gut-brain axis, which is the communication pathway between your digestive system and your brain. Your gut produces about 90% of your body's serotonin, a neurotransmitter that affects mood, anxiety, and yes, sexual desire. When your gut microbiome is healthy, it supports better mood, reduced anxiety, and improved mental health, all of which are crucial for healthy sexual function. Remember what I said earlier? Stress and anxiety are major contributors to sexual difficulties. Additionally, a healthy gut supports better nutrient absorption, stronger immunity, and reduced inflammation throughout your body, including in the pelvic region. Number 5, whole grains: brown rice, quinoa, oats, barley, Whole wheat, farro, bulgur. These whole grains retain all their nutritional value, unlike refined grains that have been stripped of their fiber and nutrients. For sexual health, whole grains are important for several reasons. First, they help regulate blood sugar levels. When your blood sugar spikes and crashes throughout the day, it affects your energy, your mood, and over time can lead to insulin resistance and diabetes, one of the leading causes of erectile dysfunction. Second, the fiber in whole grains supports cardiovascular health by lowering cholesterol and reducing inflammation. Remember, erectile function depends on healthy blood flow, so anything that supports your heart and blood vessels supports your sexual health. Third, whole grains provide sustained energy without the crashes you get from refined carbohydrates. This means more consistent energy throughout the day, better mood stability, and more vitality for all aspects of life, including intimacy. Number 4, olive oil. This is a cornerstone of the Mediterranean diet, which has been extensively studied for its health benefits. And Dr. Hinohara himself consumed a tablespoon of olive oil every morning, saying it was good for his arteries and kept his skin healthy. For sexual health, olive oil is remarkable. It's rich in monounsaturated fats that improve cholesterol levels, lowering the harmful LDL cholesterol and raising the beneficial HDL cholesterol. This directly supports the health of your blood vessels, including the tiny arteries that supply blood to the penis. Olive oil also contains polyphenols, powerful antioxidants that fight oxidative stress and reduce inflammation throughout your body. Chronic inflammation is increasingly recognized as a contributor to erectile dysfunction and reduced sexual desire. There's also emerging research suggesting that olive oil may support brain health and reduce the risk of cognitive decline, including conditions like Alzheimer's and dementia. And maintaining cognitive function is essential for maintaining sexual interest and function as we age. Number 3, nuts and seeds, almonds, walnuts, pistachios, flax seeds, chia seeds, pumpkin seeds. These little nutritional powerhouses are often overlooked, but they're incredibly important for both longevity and sexual health. Nuts and seeds are rich in healthy fats, particularly omega-3 fatty acids, which are crucial for brain health, hormone production, and reducing inflammation. Walnuts, in particular, are an excellent source of omega-3s. They're also high in arginine, an amino acid that your body uses to produce nitric oxide. Yes, the same compound essential for erections that I mentioned with leafy greens. Some studies have even shown that men who regularly consume nuts have better erectile function than those who don't. Additionally, nuts and seeds provide zinc, which is essential for testosterone production. As men age, testosterone levels naturally decline, which can affect libido, energy, muscle mass, and overall vitality. Ensuring adequate zinc intake helps support healthy testosterone levels. The protein in nuts and seeds also helps maintain muscle mass as you age, which is important not just for strength and mobility, but also for metabolic health and maintaining healthy testosterone levels. Number 2, avoid sugar and processed foods. Dr. Hinohara was adamant about this, and I can't stress it enough. Excess sugar and processed foods accelerate aging and damage sexual function. Here's what happens when you consume too much sugar. It promotes oxidative stress, increases chronic inflammation, contributes to insulin resistance, and damages blood vessels throughout your body, including the delicate vessels that supply the penis and clitoris. I see this constantly in my practice. Young men in their 20s and 30s coming in with erectile difficulties, and when we dig into their lifestyle, we often find diets heavy in processed foods, sugary drinks, and refined carbohydrates. The sugar erectile dysfunction connection is real and well documented. High sugar consumption leads to weight gain, insulin resistance, diabetes, and cardiovascular disease, all of which directly impair sexual function. Processed foods are equally problematic. They're typically loaded with unhealthy fats, preservatives, excessive sodium, and refined sugars. They contribute to metabolic disorders, heart disease, and cognitive decline. If you want to maintain sexual function as you age, and really if you want to age well in general, reducing sugar and processed foods is non-negotiable. Number 1, a holistic, healthy lifestyle. This is where everything comes together. Dr. Hinohara didn't just eat well, he maintained a complete lifestyle that supported longevity and vitality. He started each day with coffee, milk, orange juice, and that tablespoon of olive oil. For lunch, he often had just milk and a few cookies, or nothing at all when he was busy. For dinner, vegetables, a little fish and rice, and occasionally lean meat twice a week, with a bit of dark chocolate for dessert. But here's what's crucial. He wasn't obsessive or restrictive. He was intentional and consistent. He ate until he was about 80% full, never overeating. He stayed mentally and physically active his entire life. He found purpose and meaning in his work, and this is exactly what I tell my patients about maintaining sexual health as they age. It's not about perfection, it's about consistency. It's about treating your body with respect and giving it what it needs to function well. What this means for your sexual health. Let me bring this back to what I see in my practice every single day. The patients who maintain the best sexual function as they age, the ones who come in at 60, 70, even 80 years old with strong libido and good erectile function, they have some things in common. They stay physically active. Regular exercise, particularly aerobic exercise, improves blood flow throughout the body, including to the genitals. Resistance training supports testosterone production. Movement matters. They eat real food. Whole foods, plenty of vegetables, healthy fats, lean proteins. They're not on some extreme diet. They're just consistently choosing foods that nourish their bodies. They maintain healthy body weight. Dr. Hinohara noted that all long-lived people, regardless of nationality or background, share one thing. They're not overweight. Excess weight contributes to hormonal imbalances, insulin resistance, and reduced sexual function. They manage stress. Chronic stress is absolutely devastating to sexual function. It affects hormone levels, increases anxiety, reduces desire, and can contribute to erectile difficulties and difficulty with arousal. They prioritize sleep. During sleep, your body produces testosterone, repairs tissues, and processes the day's stress. Poor sleep directly impacts sexual function. They stay socially connected. Loneliness and isolation are associated with both shorter lifespans and reduced sexual activity. Intimacy and connection, both sexual and emotional, are fundamental human needs. They don't smoke. I cannot emphasize this enough. Smoking destroys erectile function. It damages blood vessels, reduces blood flow, and significantly increases the risk of erectile dysfunction. If you smoke and you care about your sexual health, quitting is the single most impactful thing you can do. Use it or lose it. The truth about sexual activity and aging. There's an old saying, use it or lose it. And when it comes to sexual function, there's actually some truth to this. During the night, men typically have 3 to 5 erections. These nighttime erections are your body's way of protecting the penis, ensuring it gets oxygenated blood flow. When these stop happening due to health problems, medications, or other factors, you can actually start to see changes in penile tissue. It can become less elastic, even slightly shorter. Sexual activity, whether with a partner or through masturbation, helps maintain this healthy blood flow. It exercises the pelvic floor muscles, which are essential for orgasms and sexual pleasure. It keeps the tissues healthy and responsive. But beyond the physical aspects, regular sexual activity is associated with better mood, lower stress, improved sleep, and even better cardiovascular health. It's part of a healthy, vibrant life. Dr. Hinohara remained professionally active until 105. He had purpose, engagement, passion for his work. That kind of vitality, that aliveness, extends to all areas of life, including sexuality. I encourage my patients, regardless of age, to maintain intimacy in whatever form feels right for them, whether that's partnered sex, self-pleasure, or simply maintaining physical affection and closeness with a loved one. Sexual health is health. It's not separate from the rest of your well-being. It's deeply integrated with your cardiovascular health, your metabolic health, your mental health, your relationships, your sense of purpose and vitality. So, what do I want you to take away from this today? Your sexual function is not just about what happens in the bedroom. It's a reflection of your overall health, a predictor of your future well-being, and something that deserves your attention and care. The same foods and lifestyle habits that promote longevity, leafy greens, fermented foods, whole grains, olive oil, nuts and seeds, avoiding sugar and processed foods, These also directly support sexual health and function. Small, consistent changes make a profound difference. You don't need to overhaul your entire life tomorrow. Start with one thing. Add more vegetables to your meals. Take a daily walk. Reduce your sugar intake. Prioritize sleep. Pay attention to your body. If you're experiencing changes in sexual function, difficulty with erections, reduced desire, pain, or discomfort, don't ignore it. Talk to your doctor. Talk to a urologist. These symptoms often signal underlying health issues that deserve evaluation, and please be kind to yourself. Everyone experiences fluctuations in sexual function, stress, fatigue, illness, life changes. All of these affect sexual health. One difficult encounter doesn't mean something's permanently wrong, but persistent problems deserve attention. Living a long, healthy, vibrant life with satisfying sexual function well into your later years isn't about luck or genetics alone. It's about the daily choices you make, the care you give your body, and the attention you pay to all aspects of your health. Dr. Hinohara lived to 105, and at 100 years old, he said he felt like he was in his 70s. That's the kind of vitality we're all capable of with the right approach. You deserve to feel vibrant, energetic, and sexually healthy at every stage of life. Your body is capable of remarkable things when you give it what it needs. Take care of yourself, not just because you want to live longer, but because you want to live well, fully, joyfully, intimately connected to yourself and others. Thank you for being here today. If this resonated with you, I hope you'll share it with someone who might benefit. And remember, your health, including your sexual health, is worth prioritizing because you're worth it.